4 deaths and multiple people blinded, and all from eye drops. This story, if you haven't heard it, will be eye-opening and a potential warning of what could come with all of Trump's FDA layoffs. It started in Los Angeles. A patient came in to see a doctor with one of the worst eye infections that this physician had ever seen. And those cases started to pop up all across the country, but no one was connecting the dots. They were in different states, different patients, affecting different parts of the body. They were in the eye, in patients' lungs. Some of them even had bloodstream infections. Eventually, the CDC traced it back to the same brand of eye drops. And these eye drops were manufactured in a facility in India. But before the recall could actually hit, there had already been multiple deaths and multiple infections associated with this outbreak. But here's the kicker. That facility in India had never been inspected by the FDA. And when the FDA eventually did investigate that facility during the outbreak, they found glaring issues with sterility throughout the facility. And that's not something that you want to find for somebody who's making something that's going to go directly into your eye. And this incident isn't a one-off. In 2022, the FDA only inspected 6% of international drug facilities. That means thousands of drugs facilities went uninspected for years. People may not realize that the majority of these generic drugs are coming from outside the US in places like China and India and get imported into the United States for us to consume. Some facilities haven't had an inspection in over a decade. There's a huge backlog from the COVID-19 pandemic, and every year the backlog keeps getting worse. You would think after a disaster like this, you would want to hire more people at the FDA. Instead, Trump has fired dozens of people, not necessarily the inspectors at the FDA, but all the support staff that actually make the inspections possible. The people who book all the travel, the people who help organize the inspections, the people who help communicate the findings to the general public of what the inspectors found. And now the FDA is hiring contractors to replace the people they fired because they realize those people were critical and important part of the process. Replacing and supporting these inspectors that do international drug facility inspections is not an easy task. There is a report from the Government Accountability Office that outlines some of this and goes into the details of what one of these inspectors does. It takes so much time to do a single drug facility inspection that one person can only do about 6 inspections every single year, because of the travel and the workup and the write-up and the communication that has to happen from both the inspector and all the support people involved. So what happens now that eye drop outbreak was already missed, and now under Trump, we're operating with fewer FDA resources, and we're backlogged even further with international drug facility inspections. This isn't making us safe. It's making our drugs and our food and everything much more risky to consume. Follow me for more public health breakdowns like this.